Good morning, Madam Chair, President, Ranking Member Joyce, and members of the subcommittee. On behalf of the 574 federally recognized tribal nations and members organizations of the National Health Board serves, thank you for this opportunity to testify for the fiscal year 2023 fund for the Indian Health Service. My name is William Smith. I am the chairman and the Alaska area representative of the National Health Board. As a Vietnam War veteran and a retired Army sergeant, I am proud to have served my country and to continue the public service by serving the tribal nations through the National Health Board. For the fiscal year 2023 and beyond, robust investments are necessary to fulfill the federally trust responsibilities and treaty obligations and improve the health of all Alaska Natives and American Indians. This funding must also empower tribes to prevent and prepare for public health emergencies. To that end, we are pleased that the President's fiscal year 2023 budget requests support mandatory funding for the IHS at $9.1 billion, which increases over the following 10 years. It is a bold vision and an end to a chronic funding inadequacy and building a comprehensive Indian health care system. We urge Congress to support the request and work together with administrations and the tribes to see that it's passed into law. My written testimony discusses this proposal and other key priorities in more detail. Today, I want to focus on mental and behavioral health facilities and finally full funding. In his December 2021 advisory, the U.S. Surgeon General found that Native youths were at higher risk for mental and behavioral health challenges during the pandemic. While advisory found on youth, these findings could also apply to our adults and other health challenges. Before the pandemic, tribal communities were already at a behavioral health crisis, according to the National Center for Health Statistics. American Indians and Alaska Native women experienced a higher increase in suicide rate from 139% from 1999 to 2017. The men between the ages of 15 and 44 experienced the highest rate of suicide of all races and ethnic groups. The overall death of the adults from suicide is about 20% higher compared to the non-Hispanic white populations. Suicide has skyrocketed for Native veterans from 19.1 to 47 in 100,000 people. But most shocking, for those ages 18 to 39, it was 66 in 100,000 persons. The pandemic devastated our communities. It highlighted the consequences of chronic underfunding. For example, according to the Substance Abuse and Mental Health Service Administration, 13% of the Native populations needs substance abuse treatment, but only 3.5% receives any treatment. Congress must tackle these issues head on with aggressive funding for prevention and treatment measures for tribes. Facilities is also necessary to make the impact on these problems. In 2010, Congress authorization the construction of inpatient behavioral health and other specified facilities such as long care, term, and dialysis. While suicide, other health problems, and cost construction has yet to be funded. In fact, Congress has not funded a complete series of health care facilities still on the 1993 waiting list. The Indian Health Service has indicated that facility construction cost alone is now up to $22 billion. Yet Congress funded the entire Indian Health Service system at $6.6 billion for fiscal year 2023. As a result, tribal leaders and health policy experts determined that full funding for the IHS is at $49.8 billion is requested to make a difference. This figure takes into account medical and non-medical inflation, complications with the costly federally mandates and other emergent needs. It also a more accurate per user benchmark based on the national health experience. Achieving full funding will be difficult given the restriction spending cap in the subcommittee's allotments, but aggressive solutions are needed to make a difference. The president appears willing to move the bar. Indian country challenged Congresses to also make a difference and move in the right direction. National Indian Health Board and the tribal nations stand ready to join in this fight to health care of American Indians and Alaska Natives. Awa'ata, and thank you very much for listening to us, and I will respond to any questions.
Thank you so much for being with us today. And our fourth witness will be Ms. Sonya Tetnowski, the president-elect of the National Council of Urban Indian Health. Thank you for joining us, and we look forward to hearing from you.